reported in the literature as it relates to anxiety, depression, autism, dementia, bulimia, chronic fatigue syndrome, burn patients, cancer pain, headaches, arthritis, endocrine factors that are occurring with this type of touch. So if we decide how we're going to touch somebody, how can we do it? I mean, it's kind of hard just to approach somebody and say, oh, I want to touch you. People might not be totally comfortable with that. But with BioTouch, there's a very specific methodology that's followed, and most of my patients are very comfortable with it. In fact, they ask for it, and they want to be touched. They want to have BioTouch as part of their care. So what we can conclude is that touch is essential to the human being's development and vitality, and that it exerts effects both locally on the surface of the skin as well as distally in the brain, and that if we deprive humans of touch, there are physiological, psychological, social, behavioral changes as well as immune endocrine dysregulation, and that social interactions that involve caring and touch might improve the health and well-being of all ages. So BioTouch, in my opinion, offers a safe, effective modality of social touch. It is the skin. The skin is actually our largest organ. I mean, we certainly think about the heart, we think about the liver, we think about the kidneys and their organs and functions, but our largest organ is the skin. And the skin is really primed for tactile interactions. And I don't want to get too bogged down in the anatomy here, but BioTouch stimulates the free nerve endings and the Meissner's corpuscle. That's a very light touch. And there are messengers here in the epidermis that activate very Western-based. This is our hospital where we did our pilot project in 2003. And so we were looking at 8 domains: physical functioning, physical role, bodily pain, general health perceptions, vitality, social functioning, emotional role, and a mental health index. And we were doing the sessions once a week. So the patient came in, they got BioTouch once a week, and we were looking at these different domains. And I thought from my experience in Tucson that a couple of things would get better. My hypothesis was that their pain would get better because I had already observed that. But I was really amazed at the fact that, and here I am doing a BioTouch right here, that at 8 weeks, let me show you the data. Where is it? Okay. At 8 weeks, we saw significant improvements in all 8 domains. All 8 domains were statistically significantly improved. And I'll go back and show you these again, okay? So we got the baseline data, and then they had once weekly for 8 weeks, and then we did a follow-up, and then we looked at them 4 weeks even after the last treatment session, and we also kept weekly logs of what else was going on with the patients. And again, the practitioners were instructed to touch points indicated by the patient's clinical condition. BioTouch is so easy. You can teach this to a 9-year-old child. I have taught it to children to do on grandma and grandpa for their osteoarthritis pain. It's your knee hurts, you look at the diagram, this is where you touch the knee. Your head hurts, okay, this is where you touch the head. So there's nothing really complex or complicated about it. It's not like an Eastern therapy, and I believe in acupuncture's benefits to my patients, but if I go into my acupuncturist and I say I'm having headaches, what does she do? She touches my foot, So with the Western mind, it's like, no, you need to touch here because this is where my pain is. And so with BioTouch, you're touching the area where they're having the discomfort. We had clinical settings, outpatient, inpatient, and work site. We went to some work sites to do BioTouch, and the women could not wait for the practitioner to get there. They wanted to be the first one to have their BioTouch. I love massage, and I don't know if we have massage therapists here today, but massage therapy is expensive, and it's also time intensive, and some of my patients are just not able to avail themselves of that type of touch therapy. BioTouch, cheap, easy, efficient. So we did not have any adverse outcomes. Nothing bad happened when we were doing BioTouch in this patient population. Okay, then we looked at another group of women. These are the women that we were talking about today, the sandwich generation, women that have a high social burden, that are taking care of a lot of people while they're trying to navigate aging on themselves. So there is a stress related to aging and menopause. There's certainly caregiver stress in these women and social burdens of aging women. And we had two groups we had a control group, no biotouch, and then we had a biotouch group. And we were looking at clotting factors, inflammatory factors, blood pressure, and weight. And we found that after the session that the biotouch group had an increase in interleukin-12 levels, and I'll talk about this in a minute, and I'll talk about it right now. You say, well, what is interleukin-12? Well, interleukin-12 is a cytokine, and it's very important as it relates to immune function. And certain infections such as TB and the common cold are related to changes in interleukin-6, which then cause changes in the T cell ratio. And we think that this type of stress-induced T cell shift contributes to the susceptibility or the progression of these infections. And this was fascinating to me because the disease most cured by the King's touch in the Middle Ages was scrofula, which is an old name for tuberculosis. And TB is really involved with this interleukin-12. Also, in major injuries, interleukin-12 is suppressed. With tumors, there's deficits of interleukin-12, and then with allergy and atopy, there's a deficit of interleukin-12. And of course, we know allergy is stress-related, and also cancer susceptibility or progression of certain tumors seems to be stress-related. So we measured stress hormones in the two groups of ladies, and this is our control group. They are not getting biotouch, and we did not see any drop in their nocturnal cortisol levels. But in the biotouch group, their cortisol levels did go down when they were getting the biotouch. It was not statistically significant, however. It approached statistical significance. We also looked at other immune signaling factors 72 hours after biotouch, and we found that the immune response was enhanced in the patients getting biotouch. And these are two of my PhDs that worked with me on the study, Dr. Pierre Neunschwander, Dr. Anna Kurdowska. You know, I get to travel, I get the glamour, I get to stand up in front of people, but I have so many people standing behind me and supporting me. And so I want you to see, you know, some of their faces too. But we looked at gene expression. These are the steps in a microarray experiment. We don't have any biochemists here, so I'm not going to belabor that. This is some of the data that I had to mind, because all of these represent different genes that we were measuring. And when they handed me my raw data on the gene microarray, it was about this thick touch. So all of that just to say that we were able to measure genes that were upregulated and downregulated when we did skin biopsies pre and post biotouch. And in the red are genes that were upregulated, and in the green are genes that were downregulated. And you say, well, what did these genes have to do with? Well, first of all, they had to do with the stress response. And so we have a pie graph here, the response to stress, metabolism, response to external stimulus and endogenous stimulus, and then cell growth and maintenance. And then they also had to do with the immune response with correcting oncogenes, providing antioxidant activity, catalytic activity. All this to say, it makes you better, okay? It makes things better. And see, I'm going to go on here in the interest of time. So this is my schematic, and I have this in my book if you're interested in reading more about biotouch. But we have all of these stressors that we've talked about today: the social isolation, death of a loved one, lack of exercise, lack of sleep, negative attitudes, toxic relationships, a toxic environment, you know, all of these things coming in. But we found that biotouch can help to buffer some of this, and maybe through the regulation of the immune response and the stress response, we could potentially be able to prevent some of these diseases, or at least minimize the expression or progression